Skin lightening creams, also known as skin whitening or bleaching creams, are topical products designed to lighten skin color by reducing the concentration of melanin. These products are often used to address hyperpigmentation, dark spots, melasma, and other skin tone irregularities. While they can be effective, they also come with potential risks and side effects. Several types of skin lightening creams exist. Derived from vitamin A, retinoids like tretinoin and retinol are used for skin lightening. They promote cell turnover and reduce the appearance of hyperpigmentation. They are often used in combination with other lightening agents for enhanced effects. Examples are retin and adhering. Hydroquinone is one of the most common active ingredients in skin lightening products. It works by inhibiting the enzyme tyrosinase, which is essential for melanin production. It is available in concentrations typically ranging from 2% when bought over the counter and 4% for the prescription strength types. Examples are Ambi Skincare and Triluma. Topical steroids are sometimes included in skin lightening formulations. They reduce inflammation and can suppress melanin production. They are usually prescribed for short-term use due to potential side effects. Examples are hydrocortisone creams. Ingredients like kojic acid, licorice extract, arbutin, and vitamin C are common in natural skin lightening products. These ingredients work through various mechanisms, such as inhibiting tyrosinase or acting as antioxidants. They are often preferred for their gentler effects and lower risk of side effects. Examples are Meladerm and Amera Natural Lightening Serum. Chemical peels and exfoliants products containing alpha-hydroxy acids and beta-hydroxy acids can lighten skin by exfoliating the top layers. They remove dead skin cells and promote the growth of new, lighter skin. They can be used in conjunction with other lightening agents for better results. Examples are glycolic chemical peel and lactic peel. Other synthetic ingredients are niacinamide or vitamin B3 and azelaic acid. They are commonly found in over-the-counter products for their ability to brighten skin and reduce pigmentation. There are several benefits of skin lightening creams, including reduction of hyperpigmentation. They are effective in fading dark spots, age spots, and melasma. They also improve overall skin tone and texture. They provide cosmetic appeal where they create a more even and uniform skin tone. This in turn can boost confidence and self-esteem. They are used in treatment of skin conditions like post-inflammatory hyperpigmentation following acne or other skin injuries. They also help in conditions like melasma that are otherwise challenging to treat. Using skin lightening creams comes with risks and side effects, some of which are skin irritation and allergic reactions. Redness, itching, and burning sensations are common, especially with hydroquinone and retinoids. Allergic reactions can manifest as rashes or hives. Prolonged use of hydroquinone can lead to ochronosis, a condition characterized by blue-black pigmentation on the skin. Long-term use of corticosteroids can cause thinning of the skin, increased risk of skin infections, and hormonal imbalances. Many lightening agents increase photosensitivity, making the skin more susceptible to sunburn and UV damage. Sunscreen is essential when using these products. Overuse of products containing mercury that are banned in many countries but still found in some illegal products can lead to mercury poisoning, which affects the kidneys and nervous system. Stopping the use of these creams abruptly can sometimes result in a return of the pigmentation, sometimes worse than before. There are a few safety recommendations to consider while using skin lightening creams. Consultation with a dermatologist before using any skin lightening creams to determine the appropriate treatment and avoid potential side effects. Prescription strength treatments should be used under medical supervision. Before applying to the face, conduct a patch test on a small skin area to check for adverse reactions. For protection from the sun, daily use of a broad-spectrum sunscreen with SPF 30 or higher is crucial. Protective clothing and avoiding peak sun hours can help mitigate risks. Follow the product guidelines regarding application frequency and duration of use. Avoid mixing multiple skin lightening products without professional advice to prevent skin damage. If you found this video helpful, don't forget to like, share, and subscribe for more informative health content. Stay tuned for our next video.